So the program I went to for my general surgery training had a rich history of bariatric surgery. At that time, I had the same point of view everyone else has. Obesity is simply something that is a lifestyle choice. You have to exercise more and eat less. That's kind of what everybody thought at the time, except for the people that really knew the background. And so during my fellowship, I learned more about obesity. I took care of folks struggling with the problem. And I watched how their lives changed dramatically. It really gave me the feeling that this was something worth doing. You have to be technically good to do these complex operations. You have to have an interest in it, and you have to have the God-given skills to do these things. And I've been blessed with that. I've been able to do operations that some surgeons would shy away from, like the duodenal switch, because I have the necessary technical ability to do these operations and do them safely. And so I think that kind of sets me aside. I don't have to tell a patient, you need this one operation because that's the only one I can do. I can tell them, what are you looking for? What fits with what you're trying to accomplish, and what fits with what you medically need? And then I can do that. And so rather than shoehorn them into what I do, we can open up the whole palette and pick the right thing for that particular patient. My approach to patient care is a little bit old-fashioned. I think you have to treat people with respect. You have to build relationships. You have to earn trust, and you have to maintain that trust. And so when I see patients, I have respect for what they're trying to accomplish. I don't need to just download what I think on them and make them do what I want. We have to have a conversation that has mutual respect and understand what their goals are. Beyond that, even in aftercare, you have to maintain that trust, that availability. I have patients email me directly if they have questions. They know they can always show up at our office with or without an appointment, and we'll pay attention to them and take good care of them. I treat folks like I would want to be treated, like I would want my family to be treated. It sounds cliche, but I believe that. I think that's important. I think that's what doctoring is. And so that's what I instill in my staff. That's the culture we propagate when folks come to see us. When you treat obesity, you treat heart disease, you treat high blood pressure, you treat sleep apnea, you treat joint problems, you treat a whole bunch of things, and you can still do it with surgery and still have a relationship with your patients. It was a no-brainer for me.